Hello everyone, this is Dr. Jawad from Total Health Wellness Center. What I want to go in today's video, I want to talk about other causes of why you may be experiencing a low functioning thyroid with the symptoms. Because again, it's not always cut and dry. So why are there so many variables? Because the thyroid hormones talk to every cell in the body. So they all have to come together. So if you have one being affected on this side, yeah, it may affect or will affect on how the thyroid hormones are being dispersed throughout the body. So you may be experiencing hypothyroid symptoms, depression, waking, loss of the outer third of your eyebrows, fatigue, so forth and so on. Now, I just want to remind that 90% of hypothyroidism is due to an autoimmune disease called Hashimoto's. So, which leads me to my first tip. Autoimmunity. Hashimoto's disease, that's when you experience a combination of hyperthyroid symptoms and hypothyroid symptoms. Now, there's no cure for Hashimoto's, so how I always recommend is to modify your diet. Stay away from the gluten, the 5 sensitivities: gluten, wheat, dairy, soy, sugar, and definitely peanuts. Those will attack the immune system anyway, so if you have an autoimmune disease, yes, that will affect how the thyroid is working. So that's definitely a tip number one. Tip number two, anemias. Now, if you have a low functioning thyroid, you may be experiencing low hydrochloric acid in your stomach, so you're getting what's called malabsorption syndrome. So if you're getting malabsorption syndrome, you may not be absorbing the iron necessary to keep the body functioning. And it's important because changes in how the oxygen gets to the tissues, anemia, that'll affect the whole system. So if you have something like an autoimmune disease, pernicious anemia, where you're not absorbing the B12, that will affect the gut, which in turn will affect the thyroid, so you'll be experiencing low thyroid symptoms. And again, with iron, if you have malabsorption syndrome and you're not absorbing the iron, that too will affect how the body's working. So tip number 3, blood sugar. This is very important. Now, with blood sugar, I always recommend glucose between 85 to 99. So if I get results back and it's 84, they're in a hypoglycemic state. If I get the blood results back and they're 100, I'm telling them what's going on. They're in a hyperglycemic state, because the blood sugar and the adrenal glands, that has a direct influence to the thyroid, and the thyroid controls the blood sugar. So if you have abnormalities in blood sugar, that will affect the thyroid. That will affect the thyroid gland and the adrenal system. So definitely, let's get your diet under control. Lastly, the liver, the gastrointestinal system, the conversion factor. Now, 60% of inactive T4 is converted to active T3 in the liver. 20% is converted in the GI system, and the other 20% is converted to usable T3 in the target tissue. Now, what's interesting about the gastrointestinal system is that is 60% of your immune system in the gut. So if you're not converting inactive T4 to active T3 due to the fact that you have a boggy liver, due to the fact you have malabsorption syndrome, or the immune system your gut's being attacked by the food sensitivities, sure, the conversion is not going to happen. So this is all going to give you symptoms of a low functioning thyroid. So these are just 4 tips I always talk to my patients about to help. Let's clean up your diet, let's fix the blood sugars so we can bring up the function of your thyroid. So I hope you enjoyed this video. If you want a free consultation, please give me a call, 630-653-2225. My website is www.totalhealthdebate.com. Again, thanks for watching.